Okay, so there are a few things I couldn't cram into this lesson, and I'll sort of shout out the topics to you, and you can let me know whether you'd be interested in pursuing them. So, can everybody see this screen?
Yes.
Yes.
Okay,
Yep.
so my big bailiwick is, and why I have been sort of on the margins of the field for 30 years, is that I see profound limitations to simplicity, especially because the world is more and more complex. That doesn't mean, and I even have, but I'm not wearing a t-shirt that says simple is beautiful. I do love simplicity, but given that, we are just surrounded by very complex things. And as I said to you, I think back at the beginning about concepts, if this is all we can be teaching people during such a cataclysmic and prolonged pandemic, I think we have to reassess why we're in health communication and health education. I'm not going to go through the dawn of time here in the field of health literacy, but my analysis, because I'm a lot older than most of you and lived through it all, is that unfortunately they used the term literacy when they named this area of public understanding of health. And literacy carries with it tremendous baggage. It really equates health literacy with reading. And even though from the very beginning they said, well, we're really not talking about just reading, that's what they did for at least 20 years. And there are real biases against illiterate people, low literate people. We equate them with being less sophisticated, more primitive, not educated, most egregiously not intelligent. And I think the term itself set the stage for us to spend many, many years just talking about simplifying words and sentences, as though somehow, simplify them and they will come. And yet, over, I don't know the exact number now, but over, let's say 800 studies in the first 20 years in the field, you cannot find clear evidence that simplifying language, whether it was for diabetes or prescription labels or for exercise routines or for chemo treatment options, that simplifying the information ultimately impacted long-term behaviors in health. And that's the truth. Yes, they might have tested well in a focus group, and people may have been able to answer more recall questions, but we have lived with false evidence. So Chris's view of the world, which I always want to let you in on so you know where I'm coming from, that health literacy has very little to do with reading, that we're consuming information in many, many different ways. And the amount of stuff I've read today about coronavirus must be less than 10%. And yet I've been consuming information all day. Information, as we've said before, rarely alone changes human behavior. Let me restate that. On its own, information is rarely the thing that's going to change your behavior. Now, as I had talked about with the anthrax events in the United States, as soon as they told us, I forget who they were at the time, the experts, do not microwave your mail, I can assure you, I stopped microwaving my mail. So there are some things when somebody tells us, we do them. But if we keep hearkening back to social distancing today, you can say it as many simple ways as possible, and yet you're not getting many people, to adhere. The fact is, people are very active meaning makers. They're making meaning out of their lives and everything they see and hear and read all the time. There's enormous differences between spoken and written language, and I think we have put them on the back burner and certainly not given enough respect to both the differences and how they overlap. And and this will be the mantra, people are already talking about whatever it is. Let's say the virus or Boris Johnson or why we can't go out and eat tonight. And that's what we would have to be asking. So we can hear how they themselves are talking.
We lost you. Did you lose her?
No.
Oh, now I got you.
Oh.
Your sound continues to muffle. I'm not quite sure what it is, but.
Huh. It does?
That last one, people are
already talking about, let's say, Boris Johnson, or why they can't gather at the city park tonight. And listening to how people are talking about things has been the key way that I have been better ready to write about that issue, by incorporating their language into the very language that we produce. Can you hear me? Just let me know when you can't, because I don't understand what that would be this time. I'm not moving. Everybody okay?
Yeah.
Okay. The other things that came out of the negative influences that came out of the field of health literacy is that we are still, even today, talking about a dominant culture and a dominant culture's perspective. And quite tragically, we have spent 30 years defining people by what they cannot do with print and reading. And every health literacy test does that. It's a glorified literacy exam. Now, I don't know, somebody is chatting. So Barbara, I think part of it has to do with their developmental stage. Barbara, do you not have sound? Do you have sound?
I doesn't have video.
I hear you. Well, I can't hear you. Why can't we hear you? Why can't we hear you? Are you muted for some reason, which would be bizarre? How would I know that?
Hi, Chris. Sorry, I was muted.
Oh, okay.
I didn't want to intervene.
Okay, but now you can cut in at any time. Let me just finish this slide and then, so again, we've defined people for 30 years by what they cannot do. We privileged medical information and specialized information, and indigenous information is this stuff people do online, in social media. And this local indigenous knowledge is really where you learn not only what people have, what skills they have and how they're understanding things, but what they want to know and how they want to know it. So Barbara, you were going to say something? Barbara's in Greece. Barb?
Hold on. I wanted to say that I think part of what you're describing is simply people's perception of risk. And a lot of it has to do with their goals, their developmental goals. Because, in Greece, for example, we have people clearly saying we want to protect our grandparents. But this doesn't mean that the younger people, especially those young adults that want to hang out or they're a certain personality type, it doesn't mean that they're necessarily listening, or if it's convincing evidence, unless they see someone their age.
Yeah, I think the whole notion of the whole field of risk perception is rich with things that people in health communication need to know. What I'm trying to do right now is just I think, Barbara, what we're saying right now, putting the risk perception in that whole big bucket of psychosocial and developmental. In this session today, I want to just tackle the issue of simplification, which is not informed by experts in risk perception. It's not informed by a lot of things. And I'm sorry to point so many evil fingers at the field, which I'm a part of in some way. But if we're going to move forward and understand why it is that people have so many lacks and gaps in what they understand, and attempt to fill it with all kinds of information, some of it's pseudoscience. We have to point the blame in part at ourselves and how we have approached local knowledge. So when all this was happening in the 80s, and I had been doing health communication for a long time, but we didn't call it health literacy. I was a linguist, and we were, you know, doing all this kind of stuff. I said, well, gee, I can fix this. They just don't know that simplicity is not the answer. But it took another 10 years for studies to really begin to show that simplification was not a panacea, and also that was very often done with great intent, but with bad outcomes. So I call these wardrobe malfunctions, and I'm just going to move through them quickly so we can get to some simplification messages of coronavirus today. The first large study malfunction was when people decided, we all knew for, you know, since the late 70s that health information, especially you know, about your insurance or about medications, was hard to understand. And I used to get paid very well to clean up language like this. Due to the fact that this drug is not on our formulary, we are denying your claim for reimbursement. All right, 11th grade level. So we'd write these things down, take the legalese out. We deny, will not pay your claim. We are denying your claim because this drug is not on our list of approved medications. Fine. And of course, in focus groups, people say, oh yeah, that's much clearer. I understand that better. Well, the point is, when you look at medication adherence, okay, you don't see improved adherence. And there are lots of other reasons for this.
And by the way, this is Andrew. I'm late in joining. Sorry.
Let's go back to the medication one, Andrew. Andrew, by the way, is my co-author on the first book we did on health literacy. So you look at the why people don't take their medications, and you know, like the first things you need to know about these messages is the insurance company has the authority to pay or not pay something, that they usually have this finite and ever-changing list of allowable medications, and not all medications are the same, and on and on and on. Those are sort of like what we were calling the other day the semantics of the message, the conceptual load under this stuff. But we also know, oh, and I don't know why I didn't, that we don't take medications as prescribed for numbers of reasons, right? I'm traveling, I forgot, it's not convenient, it gives me side effects, I don't believe I need to, for the rest of my life, be on a medication every day, all kinds of reasons. So my point is cleaning up the language. Even when everybody in health literacy was talking about prescriptions, should have been a little bit of a red flag. But then along came this very large study, which is malfunction number 2. And you know, so you have the typical unreadable prescription label. And some of you might, in some parts of the country, might still see it like this. You know, it has all of the egregious errors. Everything is in bold, everything's competing with everything else, your eye doesn't know where to go, the figure ground is all off, on and on and on. So Target got together with a bunch of experts and they cleaned up the label. Look at how nice that looks. And I remember when they said, gee, Chris, why don't you come in on this team? And I didn't want to play with them. And the point was, I didn't have very much faith that cleaning up a prescription label was actually going to have an effect on correct prescription taking. And lo and behold, they did an enormous study of thousands of people. 23,000 was in the study group, another 162,000 people not getting the Target label prescription drugs, using that refill. And they found absolutely no statistically significant difference. They honed in on specific medical conditions, hypertension, high cholesterol, and I wasn't surprised. They were a little dumbfounded, but that's a second indication that simplicity alone is not going to do it. So why do I want to talk to us about simplicity now? Because there has to be a role for it as we talk about coronavirus and other pandemics, but I don't think without doing the kind of work we've been talking about in the last few sessions, people are going to simplify in any ways that are enlightened and a match to what people need. That was the one I wanted to. So we've known for a very long time in linguistics that, you know, simple sentences can be very confusing, right? The burglar threatened the student with the knife. So who had the knife? You don't
The
know.
burglar.
Yeah, you don't really know. I mean, you'd like to think it was the burglar. By semantic connection, you can say that. You know, it was Chomsky's original example in 1982. Flying planes can be dangerous. Does that mean the plane itself is dangerous, or the person who, or flying, the act of flying a plane is dangerous? And what he introduced in the world of linguistics, what was that, 40 years ago now, was that the surface structure of something can be very disconnected from its semantic structure. And that brings me to the third malfunction, and that is simple sentences. You know, simple, even if you said, call for a meeting next month, it has the exact same surface level structure and readability as be prepared to die next month. And this is a wonderful example from our colleague at NYU, Jessica Anker, who I mentioned to you about numeracy as well. You can go through endless examples of simplified messages, and we'll look at some on coronavirus, that are very complex. And the opposite, you can go through multiply embedded sentences with a lot of ands and clauses, and yet they are understandable. So clear language is a good idea, but in my world, it's hardly ever sufficient. And that's because we are, from the day we're beginning to consume language at birth, we are very much actively using language. And language itself is a very active system. We don't have a lot of time today to talk about it, but if you keep in mind that we move constantly through stages of, I've heard something, oh, I think I've heard that before. Oh, I've heard that before, and I think it's about my diet. And I'm finally at the point of being able to say to someone else what it is I know about my diet. We do that with vocabulary from the time we're young, with concepts. And yeah, we seem to produce things for people. We expect them to recall them immediately through teach back. And there's no indication that A, that's how we process information, and B, that even when you assess people this way, it means anything. I give a whole talk on why recall is overrated. But yes, I think I started the talk by saying Boris Johnson is in intensive care. We probably all remembered that because it was a high emotionally laden remark for some of us, or it was shocking. But do any of you remember what channel I told you I heard it on? No, it's insignificant in the figure ground of things. So just because I can't recall that doesn't mean either I didn't understand it, or I'm not processing language well, or I need to simplify it for you. Your brain was telling you that's not the important thing to hold on to. Again, not for another talk, I think we have to move into a very different stage of evaluating what it is we think we're doing when we evaluate people, what we think we want them to do with the information, and work on reframing how it is that what are we assessing? And I know Andrew Pleasant has written far more eloquently than I on measurement. Probably what I'll do at the end is I'll put together, I didn't have a chance on this one to put together a short reference list as I did with the math one. I'll do that for this because Andrew and his co-authors made excellent points about this years ago. So where does that leave us? I'm going to leave this alternative to teach back because we're not going to have ample time to get into it. And maybe after the coronavirus slides, we can go back. So if you live with the idea that we're meaning makers all the time, like I heard about the Boris Johnson piece of news 20 minutes ago. And I say to myself, there were a few things I just did automatically. Well, he was doing okay. Now he's in intensive care. There seems to be a pattern because I've heard of a number of people who wind up in intensive care. And then I thought, oh gosh, I hope Chris Cuomo this doesn't happen to him. And I'm going through all this stuff. And then I'm also saying with my limited medical and biological and epidemiological information, skills, I'm saying, I wonder if there's something about, does the virus change when it's in the body that long? What causes the body to mount such an aggressive response? Now, the point is, nobody was testing me on this. It's not like I'm getting ready to explain to you what happened to Boris Johnson. It's just that we do that. If we see a limping dog in the street or clouds, we say, gee, how many miles away are those dark clouds? Do you think I can get a walk in? We're just doing it constantly. I use the example all the time, the humbling one, that on a New York City street corner, the immigrant, non-English speaking woman can size up within 4 to 7 seconds who she's going to ask directions of. How does she know? She's just using everything, all of these beautiful skills that we have. And we have to appreciate that each one of the patients and publics we're talking to are doing the same. They're meaning makers. I think the other sort of limiting model we've used in
We lost you.
well, I can't imagine why.
We lost you, Chris, for a few seconds.
Yeah.
I
Yeah,
think you moved your microphone, maybe?
I'm just maybe I can't touch my laptop.
You're back now. It's all good.
Okay, I'm not going to touch my laptop.
A
How's
nice
that?
plan. That's a nice.
I won't touch my face anymore because we have coronavirus. And now I won't touch my laptop. Okay.
It could be something beyond your control, like a neighbor is tapping into the same wireless or something. It's just,
How dare they?
well, it may not be anything you're doing.
All right, okay.
That's a lot of meaning making right there.
Yes, right?
Yeah.
Look at this.
There's the example, right?
And now I'm sizing up, who could that possibly be?
So, geez, I was really trying hard not to do this, but I'm going to do it.
Please do. Are you here?
Yeah, I'm here.
Oh, Andrew, why? What have I done now?
No, nothing. No, you all need to help me because I'm not figuring this out yet.
Oh, well, welcome to the club. You think I have figured it out? I just know the nature of what we do is so, it's based on such poor evidence, based on not sound language and language processing theory or reading theory, or, it's just not. And I think that just has to push us in the direction of, okay, if we're not just consumers of facts, and this has been known now for a long time, the facts are in the middle, and the speaker and the listener or the reader and the writer work on that stuff together and shape it. It's no longer the dissemination model, right? I just want to get through this slide to get to that whole, the old model of dissemination. I'm going to just disseminate information. Well, that's not true. If a New Yorker can make sense of this kind of map, if I can go into CVS and with a little, maybe if I've had a drink in me, if I can figure out which one of the vitamins to buy, okay, that or this sign to read that tells us something about how we have neglected the richness of what human beings do. Now, what I don't have all of, I mean, in other words, even on this coronavirus now, and I'm going to give you some examples, I know I can pick out very easily after doing this for a very long time what's wrong with the message. And I can do some things to make it a better message. But what we need is more people trying these kinds of things out. Because even last week, what did I see posted on the literacy discussion list from Cindy Brock? Who has simple to read information on the coronavirus? We really need it. And therefore, what you're going to get, and I'm going to skip over this. I'm going to go right to, I'll go back to this if it's necessary. So what you're going to get are things like this, right? Which is no better than it was when we were preparing to respond to H1N1 or to SARS or to Ebola. And
They
this
really
one,
put that out?
huh?
They really put that out? The federal government?
Hold on a second. Let me just,
Seriously?
hi, to everyone, what's the issue here? Part of the challenge is the buy. Why isn't it anybody, you have to unmute yourself so you can just talk. You don't have to chat. I hope.
I was just saying, this is Naiboni. I think like with the messaging and maybe it's also like for myself, for example, when all the information that was going out about COVID, I was like, okay, so how can we simplify this? And I think it's like my own biases or assumptions about the population that I work with that often make me think about simplicity first. How do we dumb down the information? And that's probably the wrong thought process to have. I don't know why though.
There are, I think, real reasons for that. I mean, we've been told that that's what we need to do for a long time. I'm not against simplicity, but I very rarely see it done well. That's my problem. And it can be done actually quite well by not stripping out all the concepts. By here, if you look at one example, and we can get back to the issue of biases, but here's and Andrew, the last one was actually Pennsylvania Department of Health. This one, these two. This here is CDC. Okay, this is actually off the website today. And this is in collaboration with CDC, the Health Literacy Project, and the Harvard Health Publishing. Now, this is a very, to me, typical way to minimize the amount of information you're giving the public, and yet to miss the mark entirely. Assuming, I mean, let's just take this on this side. COVID-19 is a contagious respiratory illness. This infection is caused by a new coronavirus that first was seen in Wuhan. Many infected people have mild or no symptoms, difficulty breathing, pneumonia, organ. Watch. If you look, based on what we were talking about the other day, about unpacking and looking at the semantics of this, in these three sentences, and one of them can be easily broken up into two, they are assuming some shared understanding of words like contagious, respiratory, and occur, happen. We know that the syntax, COVID is a contagious respiratory illness, that is a simple sentence, okay? The boy was hit by the car. This is a simple sentence. Many infected people have a mild or no symptom. Again, simple sentences. But what this text is failing to do is make use of all of the language skills that we innately have. Let me show you what I mean. I rewrote this, and this is just one quick example. COVID-19 is a contagious respiratory illness, keeping their sentence. That means it is very easy to pass it from one person to another, and the illness attacks breathing. Okay, simple compound sentence. Now, what happens here, and again, I don't want to sound too linguistic-y, is we know from reading studies that date back to the 50s, and then certainly in the 70s and 80s, and the way people take in and process connected strings of language, sentences, is that the connection between sentences is vital. It's an element we call cohesion. And it was studied all over the world, particularly the Russian linguists liked it, and a group of German linguists who then were here in the States. Cohesion is what helps us understand things. So many people who get sick from the virus will not get very sick. They, sometimes with really low readers, you say those people will have mild symptoms or maybe no symptoms. That becomes a cohesive unit. Here, many infected people have mild symptoms, then they move right on to a new topic with no cohesion, no connection. My point is, and I've been saying this for decades now, that is the nature of the complexity. It's not necessarily the vocabulary. It is because they read like a telephone book. Can I do one more example with you and then tell me if you think I'm just completely off the wall?
Well, can I ask, I agree that simplicity by itself can be confusing. And I think people who don't understand a concept look at surrounding things to get that information and make sense out of it.
Right.
And this idea of cohesion really helps me make sense out of that. I do think simplicity is necessary, but not sufficient. I mean, I think people need to understand basic concepts before they can act on them, and they need more.
Right.
So I think if it's too complex for them to understand it, they don't have that necessary but not sufficient by itself sort of principle. They're not even getting the necessary basics. So I'm uncomfortable ruling out simplicity entirely. I want people to understand the concepts and then go beyond that into why is it important? What can we do about it? How are people dealing with it? How do my friends and family deal with it? But I think I don't want to get rid of the part where they need necessary knowledge.
Yeah, I don't think that's where I was trying to go with this. I just think the simple that we all seem to have in mind is really deleted of anything that somebody, I mean, not anything. Yes, it's a respiratory illness. You can catch it from others quickly. Yes, that's simple information. But if you look at like the concepts we were talking about, zoonosis or social distancing, how many different simple ways have people been told to stay, 2 alligators apart, as Carla would say? If you don't have some deeper understanding or context for that simple message, I contend that most of the time I will predict that that bit of information is not, it's not going to accumulate well with other information, and it's not going to lead people to any insights or more sophisticated information. So again, sometimes you want people just to say, don't stick your finger in a plug, or don't eat the fish, it has mercury. Yes, I understand that. But I think more and more in a complex world, I find that sufficient less and less. I think that's what I'm trying to say.
Okay.
But, but I think we're making choices about this all the time. I mean, I looked at the next part of this, person to person. how does this spread? You can become infected by breathing in an affected person's cough or sneeze droplets for up to 6 feet away. Well, no, it's really a badly written sentence. It's, sort of like actually ungrammatical. Contaminated surfaces, you can become infected by touching contaminated surfaces and then touching your mouth, nose, or eyes. High-risk surfaces include blah, 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 blah. Now, well, this is a good example. First of all, just from a surface level point of view, where are the complex parts of these? Or what does your eye go to if you were doing a health literacy audit on this? I mean, if we were going to make a little list here of things that needed a repair, what kind?
Infected.
Contaminated.
All right, so first the words, those are always, good to go with. Infected, if people don't know that. Droplets, that's too much like the word drop. Contaminated. Okay, so we know we're pretty good at doing this, all of us. What else about this makes it
The length of the sentences.
say that again?
The length of the sentences.
Okay, let's look at the first one. You can become infected, okay, by breathing in an infected person's cough or sneeze. Let's stop there. So first problem
It's too wordy.
with me is not length. This sentence makes use of a passive verb construction.
No.
Can become infected. Well, that looks like something else is infected, not me.
Mm-hmm.
So how you have to activate these sentences if the information conceptually is hard. Okay? So you can get an infection, okay, or the infection can come into your body by breathing it, but you can become infected is standard medical public health language. And it sucks because every time you ask somebody who gets infected, well, they say, oh, the person that coughs. And that's because you need a little more ingenuity with verb types to deal with that kind of sentence. So to me, it's not the last phrase, droplets from up to 6 feet away is problematic. It's tagged onto that sentence and makes it more of a complex sentence. But the real complexity to me is the verb form. Now, how about you can become infected by touching contaminated surfaces and then touching your blah, 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 blah. Anybody know the classic different structure of a sentence that you can say that sentence as and it would be much more readable? That's an unfair question. This is what I studied. If then is the best way to express this.
Oh,
Yeah.
Right?
Yeah.
This is much harder to read, okay, merely because, you can become infected. Again, it is that passive construction, well, who's getting infected here? By touching contaminated surfaces, you have to know that that surface is acting on you. It is just a tough sentence, whether you hear it or read it. So if you touch a contaminated surface, okay, and then touch your face, you may get the infection. So my point being is that doesn't take anything better than good writing. Anybody see it differently? There's a way to simplify that's good, that respects and honors how people process information, and there is writing like a technician. So I learned that your obligation is to do good writing, and simple will follow if it's elegant. Simple will follow if it's understandable.
Yes.
That making any sense?
Yes.
You know, so just like the passive, that's, we've been talking about passive verb forms, using formularies like if then, because that's how we think in the world. We know the world is contingent, but we think in if then, not sort of what in linguistics is called an embedded relative clause. That's not how we do it. And the less education we have, the less we're doing that in print. We may be doing that when we're rapping or when we're telling a story, but we're not doing that in print. So therefore, when we see it in print, it doesn't work for us. I guess the question to get to Andrew's point, well, I don't know, I haven't figured this out yet, is, to me, the social distancing problem, and, we just had another little park down the street from me closed because people weren't social distancing yesterday at all. Social distancing is not a reading problem to me. No. It's not any problem with the words, whether you are Dr. Birx or Cuomo or Fox News or your local expert. So to me, simplicity here, we're challenged to say, well, how would simplicity work here? What is it that we're doing that's not simple so far?
I think in looking at that earlier passage, that it's really confusing if you're talking about something that is only you might breathe in someone else's cough or sneeze. So if people are really thinking about this, they're thinking, well, if no one's coughing or sneezing around me, why would I need to be anywhere but at a distance from them? And I can tell if people are coughing or sneezing. They're not. So it's not really telling the story of transmission.
No.
And that kind of description. And it's actually reinforcing people being closer together as long as no one's coughing or sneezing.
As long as nobody's coughing or sneezing. And I told you, I keep referring to my neighbors in this building. Well, nobody's coughing on our floor, Chris, because I want everybody to put on a mask. Well, no one's coughing. I asked them, well, wear a mask, and if you have gloves, in the laundry room. There's nobody coughing on this floor, Chris.
No.
We are so stingy with the information we give out. I really, to going back to, I forget who was saying it, about the bias we have, the inherent bias. I think part of that bias is that we really think people don't need or want this. Andrew?
Yeah, you knew.
Yeah, I do, because look, I'm in a rut. I keep thinking this. I'm challenging myself through you all. I'm spending hours every day listening to these messages and ultimately watching people's behavior and asking people about it, and
yeah, no, I'm personally really wrestling with a lot of this. For example, right, I physically distance myself and have for actually months now, more than most people.
Yeah.
Why? Because I have 86-year-old woman who I'm a full-time caretaker of now, and she's at greatest risk. But then what do, right? I pay people to go to the grocery store and shop for me, right? I'm giving them, I pay them well, but I'm putting them at risk.
Oh, gosh. Well, yeah.
Instead of myself.
You're going into a whole realm of, the trade-offs here.
So, but what I want to say is, right, I want to get off the coronavirus specifically, because what it's doing is revealing all of the inequities in our culture and society that have been around forever. And it's not just about language. It is reflected in language, but it's bigger than that, right? That we are, with this disease, see, I don't even have the words. We're defining the haves and the have-nots in ways that we haven't ever before so explicitly, and we need to solve that problem, not just the language problem.
Absolutely.
If I may, because I'm in Greece and we have other issues in Greece, and this also includes the migrant issue, because we now have an outbreak in some of the centers, and people are coming from all over the world. We don't know their level of education. We don't know. It comes down to if they trust you as the healthcare worker, if they trust you as the volunteer, if they trust what you're going to say. It doesn't, and it has to come from someone that they feel is authentic. So, at the end of the day, videos work if they're in combination with written material, but written material alone does not work.
Right.
But can I say something to Andrea? I still think, going back to what someone, I don't remember, said, it might have been you, about developmental issues and risk perception. So the whole thing with social distancing or physical distancing, I think Cuomo said, the people in New York, they're like arrogant, that they can't happen to them. And I think so much of it is that, as you're saying, that language isn't the only thing. I think we can't separate psychosocial issues with being part of the makeup of understanding why people change or don't change, or will wear a mask or won't wear a mask. I think we need to look at.
Yeah, I mean, let me be guilty here. I'm only talking about language today. That's my thing.
Oh no, I understand. Sure, sure.
I think the inequity thing to me. I mean, look, I live on the Upper East Side of New York. The wealthy part of the supposedly very wealthy part of Manhattan. They're all gone. They're all gone for the duration. They're out in the Hamptons.
Yes.
They're gone. They don't worry about it, or they get their food delivered as Andrew said, from Cinderella, and they're not suffering. And it is everyone else. I mean, I was speaking with a church group last night, and we were saying, you think we'll come out of this and people will understand how the real people that make our lives work, the supermarket clerks, the garbage man, do you think they'll get paid more? We will understand their value? I mean, no.
Interesting.
But what, to me, why I focus on information and knowledge as a key to action is I've been through enough of the complex emergencies since Katrina to say that we have not worked to close the gap, the information gap, the understanding gap at all. And this time we're doing the same damn thing over again. And if, for my little part of the world where I can do any good, instead of, oh God, let's let people in on, we're not flying blind. We know things about pandemics. We know things about how viruses work. We know things about human nature. We don't share any of this with the public. And that yawning gap has gotten bigger and bigger. And I see here, I can go, like I said to you, 10 blocks west off the beach here in Florida, and there is a poor Black neighborhood, and those people are not getting any help of any kind or any useful information, and they're not getting a paycheck. That's the making of not only an inequitous society, a violent and disastrous one. They're going to be desperate in a week or two.
Mm.
Yeah.
And desperate people do desperate things. So for me...
Yeah, but see, these things have always been evident, right? I mean, all the coronavirus is doing is highlighting things that already existed.
Exactly. You saw it on Hurricane Katrina. That changed my life. I watched that, and I watched the poor people of New Orleans who never got out, the poor people. And that changed my life, because why I started studying complex emergencies, because they are concentrated encounters of everything that is unequal and inequitous and the system that doesn't work in our society.
I think
You're absolutely right, Andrew.
I think this shows,
we all
people
agree with each other. That's
right.
why we're on the call together, right? I mean,
but I do think there are things we can do. I mean, when I get those emails about, gee, look, I'm looking for very simple 4th grade reading level material, I say, that's the problem. Don't start there. Start with what those people want to know. Learn something about your target audience. And we have not been in a learning mode generally. It's through the formula. Oh, we've got to communicate this to those people who don't have high school degrees. 5th and 6th grade level material, let's put it through the readability formula and on to the next. It's happening. That's all they do. And I know, obviously, you know me, Andrew, I no longer can be part of that club. But I'm now old enough and I don't give a damn as much that I am speaking out more about it because it's on this sandy, murky foundation that was never right to begin with. And now when you add your perspective, the perspective of the society and the inequity and perpetuating it, we have to pause.
I have to tell you, Chris, when I first met you and I started going to things like Baby Basics, and they would have us do exercises and changing the language and making it simpler. So now I'm listening to you, and it's the beginning of my needing to relearn what is important in how to get that message across. I spend too much time counting words, making them like 1 or 2 syllables. And so I thank you, but this is extremely depressing. Not that I have to relearn things, but that the situation is what it is. But I do also think, well, just one more thing, in like this exacerbates, this highlights everything, but it also highlights how people are going to behave. Some are going to be our heroes and some are going to be our villains. Mm-hmm. And it's the best of us and it shows the worst. And I think that also influences how they hear and what they hear about this virus and how they respond to it. And if it's excuse me, but if it's like, fuck the rest of them, I'm going to go play basketball in the park, that's what they're going to be thinking.
Mm-hmm. Yeah. No. Somebody was going to say something. Yes?
This is me, Andrew. I'm sorry. I'm talking too much.
No, that's all right. Well, Andrew, we can't see you sitting in front of your gorgeous pool.
Yeah, that was fake.
Where's Katina? Is Katina on the call?
No, I don't think she is.
Okay.
So, I mean, we've been trying to figure this out and we haven't. You're totally correct. But I will say, like, so I have a colleague, a friend who I've known for, 20 plus years now, who is working as the executive director of a nonprofit organization that supplies support to people who are disabled physically and mentally. Mm-hmm. Right? The audience that nobody pays attention to.
Well, Carla and Susan in New Zealand, raise your hand, ladies. They are specifically focused on the disabled.
Then you know what I mean, right? That's the audience nobody pays attention to, and they're the audience that needs the most. And you all are carrying on, as my colleague is carrying on. There's got to be a way to turn this virus into a positive message. I haven't figured it out yet.
No, you're right. And I said this the other day, there's got to be, we could be the catalyst. I mean, I don't want to overstate. There has to be, and I think we have to find ways. I mean, we have a little group now that seems to be interested in this. And I had said, I want us to put our heads together in the few minutes we have each time and come up with, what is it? Is it a series of short pieces? Is it, because, I mean, we haven't even gotten to, I mean, what I try to do is say, guys, most of us grew up in a print dominated world. We were producing pamphlets constantly on public health, and that was the solution. We have now got a public, I mean, I think I even have this here, you know, they've leapfrogged over us a long time ago with getting to information. We're still writing pamphlets and palm cards, and they're texting. I mean, the currently, 10 years ago, the most popular search engines, if you were going to go online for information about health, was WebMD and Medline Plus. You can now learn how to do hand surgery on YouTube. That's where people are going. Google is number one, YouTube is number two, and I hear it from everybody. And so, I mean, this is my 91-year-old mother and her 90-year-old friend. They sit at dinner with me and they're texting and they're reading things on, you know, not right, it's Corona. Well, yeah.
I mean, you guys tell me, here's an example. It's not related, but it is. Right, I'm doing right now an analysis of research of people's perceptions of clinicaltrials.gov, which is the American version of the collection of all of the clinical trials. And we keep hearing from people that they want to look at a clinical trial about a disease or condition that they have, and they want to take the results of that clinical trial as, in fact, medical advice. Huh. They're going to base their medical decisions upon one clinical trial. They don't know whether it's phase 1, 2, 3, or 4. They have no idea about that. And then we have a president.
Yeah, I was going to say it. We have to say it.
No, really. We have a president who's doing exactly the same thing. And I know the people at clinicaltrials.gov because they're paying us to do this. They don't want that to happen.
No.
Right? They don't want this to happen, but it is happening.
Yeah.
So,
but Andrew, we have failed miserably over the last few decades to explain what evidence is, to explain what it is to test a drug. I mean, come on. There have been missed opportunities upon missed opportunities. I remember meeting years ago when I used to be on the circuit, and I don't go anywhere anymore, and I was talking to drug manufacturers, and they were pulling out their hair because they, you know, people weren't getting into clinical trials, blah, 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 blah. This was held by Simon. And I said to them, but wait a minute. We have never explained to people the process it goes through to even think about getting a drug approved. You have Trump saying, yeah, and you had, what's his name? Navarro, not Navarro, the person he's brought on board as an advisor who calls himself a social scientist, saying there was a clinical trial in China. What was it, 15 people?
I don't know, he has a PhD just like me. But,
wonderful. Yeah, so, but
seriously.
Don't you think these are great times to say, hey, you might be hearing all over the place that chloroquine is the thing to take. As a matter of fact.
But that's exactly what I'm trying to say, right? Is that, in fact, instead of like, I know, right, that it is going to come out of the language, but there has to be a bigger, broader picture of how we're going to change the society and the culture first, and then we can build the language.
I don't see that. It's, to me, nothing happens without language. Nothing. You have to communicate with people. And language is the way we take the world. It makes sense.
See, that's why I said I wasn't going to do this, because I knew you and I were going to have this good conversation,
Whether
and
it's
everybody else is going to be bored.
no,
But
but whether it's the cart or the horse, at least my obligation is to say anything I produce for public consumption has to be the best communication it can be, and we don't say that in public health.
if
We
we
just
don't
throwing
have,
more at the wall, and then you know
if
what
we
I'm saying.
don't have, and by the way, for the rest of you, this is exactly how we wrote the book. So it's just fine. If we don't have a clear idea of what we want society to be like and culture to be like, we don't know the right words to use.
Well, I feel that I at least want to give everybody on this floor access to the kind of information that would make them be able to talk about this a little more intelligently or informally. I don't, I'm not a big thinker. I can't think of the whole world.
All I think is that, right, we've had, I mean, there was a wonderful woman on CNN from Brown, of all places, talking about how that this was going to affect the healthcare profession for a very long time, right? That it wasn't just sort of this like it's gonna spike and then it's gonna go away. And she's right, right? Because these folks are sacrificing everything in their life to help people live, and the psychological, the social, the effects to their family, it's not going to go away. And nobody's talking about, right, how are we going to help healthcare professionals? Everybody's like, oh, we're going to take care of the British Prime Minister because now he's in intensive care, so we're going to talk about that. What about the people taking care of him?
Yeah.
Right. We're not talking about them. We're not talking about what's going to happen a year from now, 10 years from now. So that's the kind of thing I'm trying to figure out, right? Is that 10 years from now, how are we going to resolve this problem?
But don't you think, maybe, and we really have to wind it up this time, but this is, we could have a session just on this alone. We were talking about the power of narratives the other day.
Yeah.
And just being able to talk with people about how, CNN's doing a lot of profiles of doctors and what they're going through and the impact on them. And, those kinds of things that we can emotionally resonate with, we know are the best teaching tools, right? They're the most memorable. They accumulate so that, the more narratives of this one type builds a whole schema in your brain, with strong cognitive drivers, so emotional drivers. We have lost interest in telling stories in public health. We don't. Oh, we're just the facts, ma'am, and some visuals. And what's happened to us?
Now you're really going to get me started.
All right. You know what? How about, because we always make a promise to end within the hour or over. What topic can we shape to have a continuation of this? Because there was two other topics that I didn't get to today, and one is the whole notion of, we're still working on writing messaging, but what has technology done and what can it do to be more of an equalizer? People are on technology and outstripping us in many ways in the types of dialogues they're having. So I wanted to do one on technology and health literacy, but this whole issue of, Andrew, what would you call it? It's the biggest picture. It is sort of, it's like remaking the world, but remaking I don't know, but I think it would be to some people a very interesting thing to start talking about.
Chris,
Yeah.
Andrew had said that we have to learn something from this. There's got to be a positive message that we get out.
Right.
And I think that it's partly how we use language that we're going to be able to look to the future. You know, a very simple thing is I spoke with my doctor today and she goes, when this is over, then you need to ... as opposed to if this ever ends.
Yeah.
And I think there's a messaging in, you know, how we use the past tense, the present tense, and the future that affects. I mean, that made me feel so good that my doctor thought this was going to end.
Maybe we should have a session called When This Is Over.
When this is over, that's when the shit begins.
I mean,
That's what it does. Yeah.
I must tell you,
Sorry.
until Andrew said this, I have not been thinking about that at all.
Yeah. You know, Sinai is saying that one of the biggest problems, not only are the healthcare workers, but their family members who are saying to them, quit. I don't want you working at the hospital anymore, because they're so afraid of this getting into their house. So there's a mental health crisis in this world. I'm a social worker as well, to begin with. There's so few resources. And if we don't begin to look at how to address that as part of overall health, we're really going to have problems.
Yeah, look, I happen to be very fortunate to be able to call a former Surgeon General a friend.
That's right. I was listening to him. Tell people who we're referring to.
Rich Carmona. He was the Surgeon General under George Bush, even though he's actually a Democrat, but don't tell anybody.
We tell proudly.
You know what I mean, right?
Yeah.
Yeah, it was yeah. So, God. So I know what Rich is saying about this. And then I hear what the other former Surgeon Generals were saying about this. And I find some real problems there. So.
I see. I haven't been following this nearly as much. So.
No, because right, I follow it because I know Rich, right? So right. I know what he says, and he knows we talk, and then I hear what the current Surgeon General is saying, which is, good Lord. And then the two former Surgeon Generals are also saying some really bad things in terms of, in my opinion, and I could be wrong. I've been.
No, I mean, I have not been, like I said, I have not been following it. Where did you all go? Wait a second.
Oh no, it's just on, online and CNN.
No, but I think, I mean, if you're willing to co-moderate a session with me, Andrew, I would like to include that. I'm just going to put it out there. I've had so many people try to subscribe to these things that I'm sure a small group of us is, more than happy to begin talking about this, because Andy, I must say, when this is over, it hasn't even hit me yet.
Yeah.
No, it's because it's never going to be over, right? That's the thing. It's never going to be over.
Right.
Well, don't tell me that now. I'm headed over to my mom. I mean, I have to believe
and mom is in the living room, right? Everything I'm doing right now is to protect her because she is at most risk.
Right.
So I've pretty much stopped my basic life.
Well, the only thing I'm doing is this. So, okay, I'm barely doing this in cooking, and so.
Yeah. Oh, what a surprise! We're doing the same thing, right?
For me, it just keeps me going. I mean, I must tell you, it's selfish.
But so, like, what I want to do is I like what you've started. I always do. I think there's something bigger we can do.
All right. Well,
like I listened to a doctor from, like I said, on on CNN talking about there's something there I haven't quite figured out yet about what is going to happen next, right? That's going to both take care of people / patients and take care of healthcare professionals. And I don't hear anybody talking about this yet,
No.
but
Well,
those
Bernie,
folks need our help.
yeah, and it's not the healthcare, the direct healthcare provider. The whole way these hospitals are structured.
Yep.
And I mean, you know, Bernie Sanders must be sitting there and saying, fine, it took a pandemic for people to understand what poor shape the healthcare system is in.
Don't start me on Bernie.
No, believe me, I'm not a Bernie supporter, but you couldn't get traction with anybody unless you finally see the system break down and perpetuate all the inequities. All right, listen, this whole thing, should I put the whole thing up, including this discussion as well?
I have no problem with anything I said going public.
He never does, you know, he never really does. All right, everybody, I know, Barbara, you were sending me some chats too. You didn't get a word in. Do you want to say something there?
No, I think I mentioned something at the end that a lot of what you're talking about is the language or what we do in building trust and how we handle situations. I mean, this isn't something new. Going back to 99, I think CDC changed their logo. They did focus groups because they were hoping that they would build trust with the public.
Right.
You know, Clinton's apology back in 96. So it's all of these little things that we do in building trust. And those of you that actually listen to Queen Elizabeth's talk, I mean, she really addressed all of the people that you mentioned before that we should be thanking, you know, from the delivery person all the way to the medical personnel. And actually in Greece, I just want to mention this for what it is. You know, there's a lot of talk on what happened in Greece and why people are trusting this one man. And he had trained in Boston years ago, and, you know, we sort of knew him from afar. But, you know, for some reason, this gentle physician, this infectious disease doctor, Dr. Tiordas, for some reason, he's managed to get people to trust him. And, you know, it has something to do about his manner. He presents the facts, and that's it. And every single household at 6 o'clock is glued to the TV to hear this man, and he just talks facts. But it's the way he says it. And, you know, one day it was very emotionally charged. And I know one of the people in your group is a social worker. I am too. I'm a clinical social worker. He said, listen, you know, you cannot avoid or say that, you know, young people's lives are more important than older people, because older people carry our history. So, you know, this was very poignant, and he got very teary-eyed, and people still talk about that moment because he really addressed what everyone's thinking. It has nothing to do with your socioeconomic background. It has to do with your family, the people that you care. So I just wanted to throw that out for whatever it's worth. Thank you.
Go right ahead, Monique.
The mother
Wait, Andrew, let Monique say something. I know she's very quiet.
As the mother of 2 special needs boys, I have to come into this from the opposite side. I have an adopted son, cocaine positive, early onset childhood schizophrenia, lots of trouble. He was just discharged from 14 months in residential. We are so grateful that his behavioral health day program is considered essential. We have to go the opposite direction and put ourselves in that path to take him to the day program where he is 1, sometimes 2 clients there. But our balance is keeping him on schedule, keeping him from dysregulating, is almost more beneficial than the exposure we put ourselves in. So I'm grateful in a different sense for those healthcare providers. You're staying in and doing everything you can to avoid it. I have to get out and be in it to avoid being back in the hospital for another reason. The other son with autism, we live this every day. We'll say a phrase, it's time to go get, they have to do a blood draw and watch him cry. Why can't I draw a picture of the blood myself? So I can use these phrases with him and ask him what he thinks. And I think as we are seeing more and more young people with autism, this is a big majority of the people we're going to be talking to in the future. So yes, simple, but in a way that is simple to them is so key for what we do.
And respectful. I mean, it just, how can you trust somebody that doesn't respect you? I think that's, you know, not to get back to the way we talk to people, but there's no respect in so much of what we produce for people. And all right, we're going to wind this up. This is the heaviest conversation.
Can we get back to you with just ideas and, you know,
yeah. I mean, and
where we go from here?
And also, I'm going to, as I said to Monique, I'm going to reset up the blog so you can post on it, because I don't use the Health Literacy Lab blog. I actually am going to read there. I just use the blog, the Public Linguist thing, to keep having this conversation, because Andrew, I do think the more we keep talking about this out loud, the better. And, you know, I guess that's what I've been trying to do in a little way with this. I'm no longer going to sit here and seethe about it.
Yeah, you know, you and I, this is what we do.
I know. And I think the other need to get confident enough to think out loud, because, you know, Andrew and I disagree so much of the time, but then when we come together, we sort of really understand much better than we ever could alone. That's what great conversations are. Andy and I have done that, Barbara. So I think if we can just start doing that and let others listen in, and if they're interested, they'll join.
Yeah, so I am, and Monique, I don't even know. I mean, you're living things that I've observed, and I could be like, you know, but no, you're taking care of your son, and you're doing great work. And I'm happy to talk about any of this with any of you. So my email address is andrew.pleasant@gmail.com.
I'm going to post everybody's email from today.
All right.
How about that?
You know, and
yeah,
I do not pretend to know what the solution to this is going to be, but I do pretend to know that there is a solution that we will figure out.
I just like very well. When this is over, I just now, Andy, that's a simple phrase, but it did it for me.
I'm simple.
Simple and elegant, right?
Oh, thank you. Yes, so elegant.
Buddy, thank you.
Thank you for inviting us to this.
Oh,
This was marvelous.
You're the best because you don't know all the answers.
No,
you ask the questions. I love it.
Like the questions, you know, it's sort of like, it's always about, Nietzsche said, just live on through all the questions. You know, let's do that.
Never stop asking.
Yeah. So stay safe.
We're thinking about you on this side of the world. It's midnight. It's past midnight, but you know.
God, go to sleep.
No, it's not late, Barbara. I've around the world more than you know, but I've really appreciated what you said. Thank you.
Thank you. Thank you. Be well. Be well. Take care.
Bye, everybody.
Bye-bye. Bye.
Bye.